morning. My name is Taya Countryman. I'm a massage practitioner for over 30 years. I'm from Washington State, and I teach continuing education, and what I teach is structural relief therapy. And it's based on osteopathic techniques of strain, counterstrain, and muscle energy. And it's a real tool you need in your toolbox because it's an alternative to the deep tissue work that sometimes has great results, but doesn't always. And I have a real patient here today with me. Hey, Bob.
Hi.
We're glad that you're here. And the first thing you did was start whining about his shoulder. So tell me about your shoulder, Bob.
It's really tight, and I have a lot of trouble sleeping on it, getting it into position to be comfortable.
Okay. And you did share with me earlier that it was kind of a deep pain.
Yes.
Right? Okay, so one of the things we do in our classes when you come and take them is we do a lot of assessment. We want you to be sure what you're doing. So this is just a little flavor and a piece of how I actually will treat a patient. So you might be able to try some of these techniques, but you want to be a professional and know what you're doing, and that's why you'll want to come to a class. But what I'm going to have you do for me, Bob, is I want you to lay on the table for me, and I'm going to come around to the other side because that's where your shoulder's going to be. Okay, so now I'm going to raise the table so it's better for my body. That's why I love this table. And the two primary muscles around the AC joint are the pectoralis minor and the infraspinatus. Well, wait a minute, they don't cross the joint? No, but the fascia comes up and crosses it. And in the shoulder, in this whole shoulder mechanism, the AC joint is the weakest link. So I want to palpate the pectoralis minor and the infraspinatus, and I want to feel if they're tight. I'm not going to poke him, I'm going to feel. So I'm going to be right here below the clavicle where I know that pectoralis minor is. And I'm going to do a bouncing technique because the fibers you tend to come this direction right across there. And I want you to notice I don't get much bounce. But when I come over to the other side, wow, I fall into a hole. So that means we must have some involuntary muscle contracture here. Now I want to actually find where the AC joint is, and I'm going to outline the clavicle to get there. Okay? And this is the anterior SRT tender point. Is that tender right there?
Yes.
And I'm going to change my direction. A little more tender there. Okay? That's about 2 pounds of pressure. So if it's tender on a big guy like this, you know you got one. The posterior point would be on this back side. Is that one tender too? Yes. So now we have to decide which one is more tender because we only want to treat one in one session. Number one? Yeah. Number two. Would you say number one is the most tender?
Yes.
Okay. So that's the one I'm going to treat. Okay, now I have to go around to the other side of the table though to do that. Here I go. I got to refine that tender point. So what I got to do is come along the clavicle so that I have my landmark. Tender right there?
Yes.
And that's the one that's tender. And I'm going to grab the inside of his wrist. I'm going to bring his arm way up. I'm going to internally rotate it. Is that hurting? You okay?
I'm fine.
Okay. And I'm going to bring it across to his hip. And I'm going to test the tender point. Better, same, worse, or gone.
Better.
I'm going to go a little more this direction. Better, same, worse, or gone.
Yeah, it's gone.
It's gone. Needs some traction here because that's what the AC joint really needs. So I'm going to step away, I'm going to lean back, and I'm going to raise the table a little bit so it's comfortable for me. And we're going to hold this position for 90 seconds. Okay, so please notice that we're shortening the small, or pectoralis, or the pectoralis minor, but we're stretching the infraspinatus. And we're going to bring him back very slowly. Now I need a reward, and you need to see it. So I'm going to come around to the other side of the table. And I'm going to palpate that same pectoralis minor and watch what happens to my fingers. Same amount of pressure, much deeper and much softer. But that's not all of his problem. There's another muscle that's a big culprit in the shoulder, and it's called the subscapularis. And what it does is it attaches to the underside of the scapula, and it comes over here and attaches to this tubercle on the humerus. It's one of the muscles that goes through the body. And that deep tension that he feels, and I know sitting at the desk, he's rolling his shoulder trying to relieve it, never goes away. And if you're a massage therapist, you know that we're doing deep work on the subscapularis usually is painful. Now I'm going to use this amazingly comfortable stool to sit down because I'm a lazy therapist and you should be too. Save your body. I'm going to bring his shoulder up. Is that causing any discomfort or pain for you?
No.
Okay. And I'm going to put my fingers right here on the axillary area, just gently. And I want to be able to reach in and find the belly of the subscapularis. So what I'm going to do is I want to get to know exactly where the latissimus dorsi is. So I'm going to have him push his elbow out and feel the shelf, let go, and reach above that. Now, even though my finger's going into the soft tissue, I'm not poking him, but then I'm going to push down toward the floor right into the belly. And that's the reaction you get. And that's with 2 pounds of pressure. So you know it's really tight. And it's squeezing his scapula against his body. And that's what he feels tight. So we're going to fix that now. So I'm going to raise the table up as high as it can go. And Bob, what I'm going to need from you is I want you to come toward me because I need to put the shoulder into extension. So come this way a little more, this direction, right there. So see where his head's right near the edge of the table. Okay, and as the table goes up, I love this table. I used to do this on my knees and I don't like doing it anymore. By the way, I'm not putting pressure on that tender point. I'm only going to press it when I'm going to ask him if it's better, same, worse, or gone. So we're going to let his arm go into extension just naturally. I'm going to do a little bit of internal rotation and then I'm going to test that muscle. Better, same, worse, or gone.
Same.
Okay, so I got to get creative. I got to figure out what he needs. So maybe I'll do a little external rotation. Better, same, worse, or gone.
Yeah, that's better.
Much better. Okay, so that means I go more in that direction. So we go back a little more. Better, same, worse, or gone.
Much better.
Okay, gone?
Yeah, it's gone.
It's gone. Okay, so see how I'm kind of hunched over? Hey, look what you can do with your stool. Have the table as high as it wants. Any problem in my back? No, it feels comfortable. How's it feel for you, Bob?
Good.
Okay, there's some alternative ways to do this. There's some real assessment skills you're going to get in the class. This is why you want to come to an SRT class and we have fun. As you can probably tell by the way I'm talking really fast, but we really enjoy ourselves in a class. And we're going to hold this for 90 seconds.
Okay.
So now that we're done with the 90 seconds, I'm going to just bring him up very gently and have you scoot over for us. And we're going to bring the table down because I want him to stand up and I want you to actually see the difference of what it looks like now that we've released both of those. Okay, Bob, so we're going to have you roll to your side and stand up. We would do some education about how the way he stands up. And let's have you come again, and I'm going to come around to the other side of the table. Now, if you go back to the beginning of this video, you're going to see how much less stressed this looks, how it's not rolled as far forward. And how does it feel, Bob? Why don't you roll it?
Yeah, it's a lot better.
A lot better. Okay. So it's going to take him a few days to get rid of all that muscle poop. That's going to be another video you're going to see someday. But that inflammation before he'll be able to lay on it. But he's going to feel very different over the next few days. Thanks, Bob, for being part of the video. We hope to see you at an SRT class soon. Thanks.